Gentlemen, if you have pelvic pain and you're struggling to find something that helps, you are not alone. As a men's pelvic floor physiotherapist, I see men in the clinic every day, and the truth is, there's no magic exercise, stretch, or activity modification that's just going to miraculously cure everybody's pain. Pelvic pain is highly multifactorial, and just because something works for someone, it's not always going to work for you. So today, we're going to attack this problem by outlining a 3-step plan that I tell my men in the clinic to follow in order to find something that works for you. Pelvic pain can quite simply be defined as an unpleasant sensory experience near the genitals or pelvic floor muscles. Now, there's a whole host of reasons why that can occur, whether it be a medical issue such as prostate inflammation, a urinary tract infection, or a sexually transmitted disease. These are issues you must absolutely see your family doctor for. However, there's a large population of men who experience pelvic pain and who have been medically cleared, and quite honestly, a lot of these men are lost, frustrated, and unable to get the right information. So let's jump right into it. Step 1. First, we have to identify the provocative tasks. The first question we need to ask ourselves, what's constantly aggravating my symptoms? Sitting, sexual activity, running, even some stretches or gym exercises. Your job is to identify the activities that flare your symptoms up consistently. Because if your nervous system is constantly being irritated, it becomes very difficult for symptoms to settle down. Now, this doesn't mean you should fear movement or stop living your life, but temporarily modifying or reducing provocative activities can help calm the nervous system enough for recovery to begin. Step 2. Down-train the pelvic floor. A lot of men with pelvic pain have pelvic floor muscles that are overworked, guarded, or constantly bracing. And sometimes they don't even realize that they're clenching. One strategy that can help is gentle perineal release work. You can use 2 soft inflatable balls and place them between the sit bones, where the pelvic floor rests. But this is important. The goal is to not aggressively mash the tissues and try to achieve an end result. The real goal is nervous system down training. While you're on the balls, think about gently expanding your belly outwards and allowing the pelvic floor to subtly drop. It's a very slight, minimal feeling, but you want to try to feel a gentle increase in pressure in the pelvic floor as the belly expands. This is sometimes referred to as paradoxical relaxation, learning to stop fighting the tension and instead teaching the body that it's safe to relax. For many men, this becomes less about stretching muscles and more about calming a sensitized nervous system. One fascinating thing that we see in chronic pelvic pain is that the brain's ability to interpret signals from the pelvic floor can actually change over time. This is called altered proprioception, and in simple terms, you can lose the ability to clearly map or sense what's happening in the pelvic floor. And that's why so many men struggle to describe their symptoms. They'll say, something just feels uncomfortable down there, or something feels off, or I can't relax. I can't tell what's right. Chronic pain changes the nervous system, which is exactly why recovery often requires more than just stretching tissue. Sometimes, the real goal is helping the brain and body feel safe again. Step 3. Find the right movement strategy. Pelvic floor stretches can absolutely help some men, but here's the mistake some people make. They assume that there's one magical stretch for everybody. Some men respond really well to some deep hip mobility, but others do better with gentle movement flows and nerve flosses. This is simply because pelvic pain can be driven from different areas of tension in the body, and everybody's so individually different. So instead of asking, what's the best stretch? Ask yourself, what makes my body feel safer, looser, and less guarded? You want to explore movements that reduce symptoms, not just force flexibility. This could include a happy baby's pose. Lie on your back and separate the legs gently, feeling a stretch in the groin and pelvic floor. A child's pose, where you do a gentle stretch in quadruped and you feel a stretch in the low back in a flex spine position. Hip rotation stretches. Something like a pigeon's pose, where you're able to get in deeply to your hip rotators. Or it could include something like walking around the block a few times. And as mentioned, it could include breathing-based mobility flows and nerve slider movements. And if one stretch consistently aggravates you or it doesn't feel right, that's useful information too. And throw that in the list of things we don't want to do. If you feel like you've tried these things and you don't find them all that helpful, sometimes you need another set of eyes. And there's absolutely nothing wrong with that. Seek out a men's pelvic floor physiotherapist for guidance. Again, pelvic pain can be highly individualized, and finding a physio who is an expert in assessing biomechanics, alignment, and movement can make all the difference in the world. A physiotherapist can help with more than just advice. They can help with soft tissue releases, dry needling and acupuncture, or just a more targeted intervention. And in my experience, the best outcomes typically happen when hands-on treatment is combined with active recovery strategies like movement, breathing, and nervous system regulation. If you want a quick 5-minute follow-along pelvic floor stretching video, go ahead and check out this video up here. And if you found this video to be helpful, please hit that like and subscribe button for more content on men's pelvic floor education so we can keep showing this to more men who might need to see it. Thanks for watching.